Welcome everyone to 22nd Annual Congress Pakistan Society of Hepatology. I am Dr. Mohammad Nabil Shafkat, postgraduate trainee of gastroenterology from Department of Gastroenterology in DHQ Hospital, Gujranwala. I am presenting an article related to neutrophil to lymphocyte ratio as a predictor of endoscopic damage in caustic injuries. The main authors of this study are Naveed Aslam, Fawad Iqbal Janjua, Mohammad Kamran Farooq, Najmus Seher, Mehwish Mustafa, Mohammad Nabil Shafkat. When we look at the patient with corrosive intake, we know that it is a medical emergency and it is very prevalent in our society. And endoscopy is usually recommended as a first initial diagnostic tool. It not only helps us in prognostication as well as management of patients with caustic ingestion. Usually endoscopy is performed as early as possible within 24 to 48 hours. Most commonly used classification system to grade the mucosal damage is the GARD classification. Neutrophil to lymphocyte ratio is used as a marker of inflammation in many previous studies. So we conducted this study to find out a relationship of neutrophil to lymphocyte ratio to the damage or to mucosa of esophagus and stomach caused by the corrosive ingestion, and to assess if this can help predict the severity and the extent of damage caused by the corrosive in esophageal and stomach mucosa. Objective: to determine the values of neutrophil to lymphocyte ratios of patients with corrosive injuries, and to assess the correlation of these inflammatory markers with organ involvement and the degree of injury. It was a cross-sectional study carried out at Gastroenterology Department of DHQ Teaching Hospital, Gujranwala from 1st January 2021 to 31st December 2021. All the patients with history of corrosive intake were included, which belonged to an age group of 14 to 60 years. Those lesser than 14 years or greater than 60 years were excluded from the study. In every included patient, an endoscopy was performed in a dedicated endoscopic suite of DHQ Hospital, Gujranwala, and a structured endoscopic protocol was followed. The GARD classification was used to assess the esophageal and gastric mucosal injury within the first 24 hours. Within the same first 24-hour period, we collected the CBC sample and the reports were analyzed for neutrophil to lymphocyte ratio. When we look at the distribution of gender, grade of injury, suicide and substance used for suicide attempt, we noted that 76.1% were female while only 23.9% were male. However, looking at the suicidal attempt, it was surprisingly higher that around 84% of the patient had a suicidal attempt while only 16.1% of the patients had corrosive ingestion due to some error. With regards to relationship of grade of injury with cause of corrosive ingestion, it was surprisingly high in case of suicidal attempts, which means that high-grade injury was seen in those patients who had corrosive ingestion due to a suicidal attempt, while in those patients who had taken corrosive intake for due to some error, the mucosal injury was usually low grade. With regards to comparison of neutrophil to lymphocyte ratio between low and high grade injury, our results demonstrated that if the neutrophil to lymphocyte ratio is 5, means it is low, it is predictive of a low grade mucosal injury. On the other hand, if the neutrophil to lymphocyte ratio is high, it shows that there is a chance of a high-grade injury in esophageal as well as gastric mucosa, and this result was statistically significant. While looking at the receiver operator curve analysis, the area under the curve was 0.838, which was statistically significant with a 95% confidence interval. When we look at the sensitivity as well as specificity of neutrophil to lymphocyte ratio in prediction of grade of injury, it showed that the differentiation between low grade mucosal injury versus high grade mucosal injury at a cutoff value of 3.5, the sensitivity was 96 while the specificity was 63.3%. If we increase the cutoff value of neutrophil to lymphocyte ratio from 3.5 up to 5.5, the sensitivity as well as the specificity to differentiate between low grade injury versus high grade mucosal injury decreased from 96% to 75% and 63% to 35% respectively. So in conclusion, nucleoside to lymphocyte ratio values are predictive of grade and severity of corrosive injury. High levels of neutrophil to lymphocyte ratio indicate severe caustic damage, extensive involvement, and the likelihood of developing complications with high sensitivity. A low neutrophil to lymphocyte ratio may be directive in deciding a hospital discharge. These were the bibliography we used for our research. We are thankful to PSH committee who selected us for oral presentation in 22nd annual PSH 2022. Thank you everyone for your time and attention.